Hello, it's Rosie from Onelife Training with my colleague
Steve, Onelife.
We were just having a chat about injuries, particularly sprains, strains, bashes, bruises, but we want to talk to you about when somebody falls over and injures their leg or their ankle, and what do we have to do as a first aider. And we were just having a chat on actually how straightforward that is, and it's not complex, is it, Steve?
No, very simple. When I teach broken bones or soft tissue injuries, sprains and strains, I say to people, have you had one? And a lot of people have had that injury. And I say to people, what was the one thing you didn't want anybody to do when you get an injury? And they all come back and say, touch it or move it. Mm-hmm. So there's your treatment, really, for a broken bone or soft tissue, like a sprain or a strain. Don't touch it. Obviously, you might have to touch it in certain circumstances, but if the person's comfortable and the area is in a comfortable position, just leave it.
Yeah. No. Yeah. And that's something really important, I think, that Steve's just picked up on as well, is consent, working with your casualty, working with your person. If they don't want you to touch it, if they don't want you to move it, if they don't want you to do anything, we're not doing it, right? Yeah, okay. We're not saying, oh, I can see what you've done because I've done that before, and what I would do is A, B, C, and D, and we're now going to hold you down and wrap this up and put this on. We're always working with them and their consent, really important.
As a young Cub Scout a long time ago, back in the 1970s, I did first aid, and we used to mummify people with dressings and bandages. It was a thing. We used to, if someone had a broken leg, you would get a broom handle and strap the broom handle to the leg to make a sort of homemade splint. You know, the key thing now these days is, again, don't move people. If you've got to move somebody, you've got to move them, and you may have to immobilise the injury. But 9 times out of 10 in a workplace environment, if you're calling an ambulance or you're calling somebody, you don't need to move it, or you move the injury area as little as possible. So you don't want to be strapping things around it, you know.
Yeah.
Unless you really have to.
And those types of things come up really quite often in our first aid training, don't they? Where people are looking at it like it's really complicated. Like, you've got to get the broom, you've got to do the strapping, you've got to put them in this position, you've got to know to take the pulse, you know, you've got to do this. And really, a first aider's job is just to make sure that the situation doesn't get any worse whilst we're with them, and making sure that we can keep them safe, and then we can hand them over to the next stage of care, and that we've organised that. You know, we've called the ambulance if it's needed. We know when somebody needs that extra help, and we know when, you know, we're outside of what we can do, and when the next stage is required. So one of the things with falls and sprains and strains and bashes and bruises is that there's no requirement for us to diagnose. There's no requirement for us to look at, you know, if it's broken, you know, let's try walking you around, you know, if you can walk, it's not broken, and all of these things that we got taught when we were younger, all of this, you know.
There's a perception first aid that I see a lot in training, that people think they must have to do something, and quite often less is more. As long as the casualty is being looked after and being monitored, in case they go downhill with some underlying condition or some other issue you haven't found, and they go downhill, just being there is often quite enough. Talking to people, communicating with them, make sure they feel okay, keeping an eye on them, being there until the next stage comes in. That's all you can do. This subject is a classic for, oh, I better do something. Yeah. This person's broken an arm or broken an ankle, I better do something. Well, if you don't need to, you don't need to. An immobilised injury is quite often the most comfortable, and you must be patient-led. If the patient doesn't want to move their arm, you think, well, I've got to put a sling on. No, as long as it's immobilised, maybe like that, that's fine. And you're not going to, if the patient doesn't want to move their arm or leg, and they're in agony, they're not going to let you do it anyway. So follow them.
And in the classroom, if we're talking about breaks, we don't go terribly in depth, do we, Steve? No. Because as a first aider, we haven't got to diagnose whether you've got a break or not. If you've got an open break, we're going to see that quite clearly, and we're going to know that, but it's not our job to do anything about it. It's not our job to fix it. If you've got a bash, a bruise, a sprain or a strain, then we've got an acronym that we use called RICE. Yeah. So do you want to tell them about RICE?
RICE, there may be some argument about this, but RICE is rest. Obviously, you've hurt something, don't keep running around with it, so rest it. Ice it, initially to take the swelling down and cause it, make it a bit more comfortable. Compression, where you put a compression bandage on it, and that ideally compresses it, stops it moving and helps it. And elevation is elevate the wound. It's always good to elevate an injury or a wound because it takes pressure off it by elevating it, you're taking the pressure out. There is some discussion, certainly in sporting circles, about the ice piece and the compression piece. There is a school of thought that says, don't ice it and don't compress it, you must let the injury swell. You must let it do its own thing. By icing and compressing it, you're interrupting the body's natural healing process, just let it swell. Okay, so there is some argument about that, and you'll see different sides of the argument. In current first aid training, we still do teach ice, and that is the way to do it.
Yeah. So just to clarify our conversation really, if you think it's a break, you're not fixing it. You are calling for help. You are stopping them moving. Yeah. We're not going to ask them to, can you do a little jog? Can you move your arms and can you move your legs? None of this checking for all of that stuff. Just keep them still. Call for help. Get them into the hospital. And if we think it's a sprain or a strain, we might go with the RICE method. But really, it's kind of common sense, isn't it? Yeah. And not doing anything that's going to make the situation a lot worse. As
always, be patient. Let them do what they want to an extent. Follow those principles. Just watch them and be there for them.
Yeah. The key. Yeah, and comfort, reassurance, all of that. And that's it. Hopefully that's been helpful. Thank you.
Thank you.